Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
We are back at the Research Works podcast desk at AusACPDM, this time with paediatric orthopaedic surgeon Wade Shrader. Welcome, Wade.
Thank you so much. So excited to be with you.
Very excited.
Yeah.
We've chatted a lot already.
We have.
So we're going to continue this conversation.
We will.
Yeah.
So you're our first orthopaedic surgeon on the desk for the day.
Yeah.
We've had lots of physios.
We have, actually.
It's been a physio-heavy day.
Yes.
So we're excited for a bit of a change of pace.
There we go.
And
Happy
we're going
to represent the orthopedic surgeons.
Love that. So good.
And Wade, your work is out of Nemours Children's Health. You're the chair of Cerebral Palsy, and you are a father of two.
I am.
Yeah.
I have 27-year-old triplets, 2 boys and a girl. Both the boys have CP.
Yeah.
Triplets.
Right.
Wow.
And then we have another 18-year-old, so I have to mention her. Right?
of
But yeah,
course.
4 kids total.
Just in case they're listening.
Just in case
Yeah,
she
we
ever
gotta-
listens to this,
Yeah.
then she's going to point out, right? But 27-year-old, both the boys have CP.
Yeah.
Okay.
So, Wade, we're going to talk to you about your paper today. I've been practicing pronouncing this. It's maybe the longest title we've had.
I think it probably would be, yeah.
Here goes.
The most monosyllables. Go for it.
Percutaneous tendon lengthening and selective percutaneous myofascial lengthening in children with cerebral palsy, establishing surgical indications using the Delphi method.
That's it.
Wow.
You did great. That was perfect.
Really, really good.
That's it.
Look, this one
Long title.
caught
Yeah.
my eye.
Yeah.
Obviously, because there's been so much talk anecdotally about, let's just call it SPML. Should we just call it SPML?
Let's
from
do
now
that.
on?
Yeah.
That's
Yeah.
really
Yeah.
nice.
Yep.
And that's often what people would refer to it as
Right.
SPML. We've now given the full title for
Yep.
it. And there's been so much talk about, what this procedure is. As a physiotherapist or physical therapist,
Yep.
we often, have encountered children who undergo surgery.
Yep.
And there's different kinds of surgery available. And this one creeps up quite frequently. Yet when I look into the literature, I see not very much at all that would
Not much at all.
substantiate the number of people who seem to
Right.
go for this.
Okay.
Who asked for it, right?
Yeah. Talk
Yeah,
us through
so
this.
so I think this is part of this Delphi group that we put together. The group was called CP Mission Impossible.
Love
with
that.
with
I like
really
that.
the Mission Impossible part of it was to try to get surgeons to agree on what the indications were
Tom
for
Cruise was
something
not
like
involved.
cerebral palsy, right? So hard to agree.
Yeah.
So, but we got an international group together. Of over 300 years collective experience
Wow.
between all of us
Yeah.
of treating primarily kids with CP with also gate lab experience.
Okay, great.
So it was
Yep.
a selected group,
Yeah.
and we've done multiple papers. You see it published for us
Mm-hmm.
previously on the consensus of an indication for different surgical procedures like
Yeah.
hamstring lengthening
Yeah.
Yeah.
or femoral derotational osteotomy.
Mm-hmm.
And on the list, one of the things that we added to kind of as a topic to talk about and to study and see what each other thought about was percutaneous tendon lengthenings, right? Because it is such a hot topic with our families.
is,
Right.
yeah.
Families come and we know they ask for this specifically.
Yeah.
Yeah.
It's not common, it's so interesting. There's so many things that I do
Yeah.
that families don't come in and ask me, how are you going to do that technically?
Yeah.
But this is an area when we're talking about tendon lengthening
Yeah.
that families really have some preconceived ideas about.
Right.
And so that's why we decided to add this into our list. A little bit different
Yeah.
than the other list. And so
Yeah.
it took us down a little bit of a different road, but we have this process where we go through and do an iterative process of coming up with the questions. And for this in particularly, this reason why the title is so long, it is both talking about SPML, which is a particular type of percutaneous procedure,
Okay.
and what we would call traditional perc methods or percutaneous lengthenings. And so, and our group was very intent on saying there is a difference between these two techniques.
Okay.
And so we defined what that difference was. We would say that probably like a percutaneous heel cord lengthening or percutaneous hamstring lengthening or adductor lengthening is different than SPML. That is
Okay.
done, the percutaneous techniques or the people that advocate for that would use a single knife blade and
Yeah.
go in and like totally lengthen that tendon through a
Right.
percutaneous fashion. The SPML takes that a bit further, where they use multiple, even smaller knife blades or even needles to make really like a pie crusting type thing
Yeah.
on the fascia
Yeah.
It's easiest to kind of think about that along the gastrocnemius fascia that then allows for lengthening of the muscle unit through that.
Yeah.
And so, those are different technical, surgical techniques, of course. And so we wanted to ask the panel and ask our consensus group what our opinions were about those two different things and to differentiate that. But one of the driving things was it seems like that proponents of SPML in particular, it's almost like a whole world of its own. People some of the surgical teams that do this are very ardent supporters, and family members who go there are also, they buy in for that.
Yeah.
And so, the parents read it in different social media groups.
Yes.
They read it on the internet.
Yes.
One of the questions that we asked was, are families coming to you asking you for this procedure? And the answer was overwhelmingly yes.
Wow.
And the other question was, are they telling you that they've heard that it was better than traditional surgical techniques? And the answer for that also was overwhelmingly yes.
Wow.
So our experience around the world is similar to what it sounds like it is here in Australia, is that parents are hearing about this.
Yeah.
They're hearing about it really largely through social media and word of mouth from other family groups and all, and they're asking for it.
Yeah.
But what the big point of our paper was that this group of surgical experts in the treatment of kids with CP really looked at the evidence critically and said that there's really not a lot of evidence to support using it.
Yeah.
And so for sure not evidence to support currently. Currently there's not evidence to support saying that it's better in terms of surgical techniques, in terms of improvement of function or pain relief or recovery.
Yeah. Well, those would be the reasons why you would have surgery, is to hope to get a good functional outcome, relief of pain.
And it's a natural thing for families to want that, right? When you're facing a child, you have a child with a disability, you're going through all of those emotions and everything of trying to navigate the best path for them. Yeah. They naturally, if they hear that something is less invasive and less painful, but is just as good, why wouldn't you want that?
Yeah.
And the point of our paper was that all sounds great, and we are certainly seeing that with our families. They're asking for it.
Yeah.
But right now, the level of evidence just really isn't there.
Yeah.
There are very few studies in the published literature on SPML, no comparative studies, and no studies really using instrumented gait analysis, which is what most of us who do a lot of CP work would say is kind of our standard of care towards measuring our outcomes.
Yeah, it really speaks to the power of the internet and social media, the snowball effect that these families talking about these procedures has, and it almost plays into this, I don't know, people feel like they're missing out if they're not having it, because everyone wants the best for their children, right? And if you're snowballing this idea of a particular treatment and how effective families say that it is, that kind of, you're almost, from an evidence base, you're behind the game. So I love that, this work is kind of cutting through that and saying, well, no, this is, we've got people who are experts in this field establishing the evidence base for this particular procedure.
That's what we're trying to do. So hopefully that helps, it helps families ultimately, but hopefully it helps other providers help families.
Yes.
And it doesn't help that, right, there's the centers, I'll say the centers that do a lot of SPML, they're really pretty isolated. There's only 3 or 4 in the United States.
Right.
There's not very many around the world.
Okay.
People will, just like they do for other alternative therapies or some stem cells or things like that, they will raise money and fly to different parts of the world to get this procedure.
Health tourism kind of
a little bit of that, right? And so and so it was really interesting. Obviously these questions were focused on, what do you think, does SPML increase the risk of complications, for instance? And some of the panel really thought that some of the other traditional percutaneous techniques are still fair, and some other people disagreed with that. But it was they did raise a big concern that the SPML techniques would increase the risk of complications, including over lengthening and neurovascular compromise, because it is a bit of a blind sort of thing.
For sure.
Right?
And that's why you do studies, is to look at the safety profile as well. It's not just the efficacy. But I feel like there's a few things in that as well, like in terms of like the so what factor, right? So if someone is willing to travel, they want to go, they hear that it's really good, the so what for me, the first thing that stands out, apart from the finances of how much it would cost for someone to do that, like that is huge as it is. But are you then having an intervention that either one you don't really need, or another intervention would be so much more effective during that time in life? We know children with cerebral palsy,
for that particular child.
Yeah, that's right. Those are very precious moments when, as they're growing, to time these. This is where the studies have been done, right?
Right.
Like, when
Absolutely.
do you do them? Frequency of intervention.
Yeah.
It kind of takes that possibly away. That sort of it's a trade. You've already done surgery, but what's the actual outcome?
No, I think that's exactly right. And I think it's so hard for family members to look at that decision and to try to critically analyze it after they've done it.
Yeah.
Right? They look back at what they've done. They've made a decision. They've invested, even if it's not money, they've invested a lot of time.
Yes.
Right? In this procedure and the recovery for their child. So it's incredibly hard, that cognitive dissonance, to say, wow, to look at that objectively. That's why I think the gait lab outcomes are really, really important. You know, I think some of the kids that I think have said SPML, we might have done something a very similar way, but we would have, maybe the surgical technique might have been a little different. So maybe on those kids, the outcomes are similar if we find out that the technique is similar, which we don't have that evidence right now, but we sorely need it. There's other kids that we look at that we might say we wouldn't have done anything. They're in this partial, as you said, they're in this really rapid growth phase. They're really improving on those motor trajectory curves. And so how do you know that this very minimally invasive surgery, technique, how do you know it did anything to alter that trajectory? Unless you study it really rigorously, you really don't know that. And then obviously there's those families that have some bad outcomes with that, which is really, really unfortunate as well. So,
what kind of bad outcomes are we talking about here?
So I think sometimes it's the one thing that the consensus panel was very clear on was not to do plantar flexure lengthening percutaneously. Right? That's been talked about before. It's been shown in other ways, but not really in this broad consensus group like we did in this paper. And so we said both for traditional perc techniques as well as SPML, you're really in danger of over lengthening, which can cause iatrogenic crouch. And so you should avoid that in ambulatory kids, period. Right? Other issues is you could have neurovascular compromise. The sural nerve, for instance, goes right down the middle of your calf. And, we visualize that when we do a gastrocnemius recession and move it out of the way. Right? And so if you're doing it just by stab wounds, I think the position of the sural nerve is a little bit variable. It's a little bit hard to know that. It's subcutaneous. So I have seen kids that have had sural nerve, neuromas as a result of that with a lot of chronic pain.
And I guess this is why you can't use social media as the evidence base or the evidence, because the more you look into it, I mean, I've done it. I look at my feed is mostly about cute puppies and pandas, to be fair, because I want mine to be very positive. But the more you look it up, the more you get from other sources. So you get this confirmation bias, but you never see the bad side.
No, you don't.
And so it doesn't mean they have 100,000 followers that equals evidence or expertise. They're trying to tease them apart is really important.
And that's the challenge of clinical medicine these days, right? Is to try to integrate what we're doing and trying to meet families where they are because they're hearing these loud voices on social media that this is better or that this is, you should do this. It's going to be less pain. And
it takes a lot of credible voices to overpower the not so credible but very loud ones.
That's right. And when they have other families that have gone through it and maybe they went
powerful
through it,
testimonies.
Incredibly powerful, and maybe they went through it and it wasn't really traumatic for them. So maybe they really hook on to that. It's hard to know. That's great that they went through a procedure, that was their experience. It's hard to know whether it was effective or not unless you study it.
Right. So I feel like we've covered some of the main points from the consensus from the Delphi, but can you talk to us about, I suppose, there's an age component to this as well?
Absolutely.
Can we talk a little bit about that?
Yeah, I think so traditionally, I think most of the kids that have SPML, most of the centers that kind of that are advocates that market for that are typically younger kids who, as I mentioned before, they're really on that rapid growth chart. We know on our growth charts, on our trajectories of motor development, that time between 3 and 6 is a very steep curve, and they're improving really a a lot on their own.
Yeah.
Yes.
And so doing interventions during that time point, I think is incredibly fraught with really being able to say for sure that you know that your intervention caused the change in that particular child. And, and that's happens whether you're studying orthopedic surgery like tendon lengthening or tone management like SDR or even stem cells, right? It's really, you really need a robust control group in order to know that.
Yes.
And so I think those were the messages from this consensus group. The other message that kind of came about, and we touched on a little bit about where are patients getting this information from?
Yeah.
We ended up going down a bit of a road about the ethics of surgical treatment and really any treatment of children with a disability.
Yeah.
And these are very vulnerable families. They're desperate. They're going through a lot of grief. They're just trying to do they want to look back on their lives and say, I made the best decisions for our children.
I did everything we could.
I did all we could, right?
Yeah.
And so it ended up becoming where some of the members of the panel were really critical of how some of that got marketed. And which I think was a really powerful statement. So it's so much so that instead of us kind of piggybacking that onto the thing about these percutaneous techniques, we created a whole nother survey about the ethics of surgical decision making. And so we're working on that now. And so I think that will be also a very interesting paper.
Absolutely. I hope you'll come back and talk to us about that.
Can we do that? Yeah, please do.
Because
I think this is really important work, and the amount of work that you do need to do to sort of counteract testimonial anecdotes that are very strong and present online takes a lot of work on people like you and the whole community of surgeons and researchers to provide information.
And it's a really tricky thing to do, because often the misinformation that's out there is very emotive, and it's it's done in a certain way, and as people who are trying to communicate an evidence base, we can't do that.
No.
It's, we talked to Jessica Stokes-Parish about making sure that information is credible and, that if there's any conflict of interest that you're declaring it. And
that's right.
That stuff's not emotive. It's, it's factual, and it's,
so
it's
somewhat
important.
cold, right?
And
some parents can feel that that's a bit abrupt when you're trying to do that. And I was saying before, I'm the first one to admit, a lot of what we do in orthopedics, in CP, doesn't have great evidence behind it either, right? So we have to approach that very honestly. I can't show them double-blinded, randomized control trials that what I'm proposing is better than what some other people down the street might be proposing. But I think we have to be honest about that. We have to be very trying to meet the families right where they are. We have to understand their emotions, and we have to try to share some of those emotions about where they're coming from and how we deliver that the best evidence that we have.
That's right. Which includes outcome measures, because
very important.
Right? So that we might not have the highest level of evidence, but at least be measuring it on that individual level. So
that's right.
Again, we could talk about this for so long.
For sure.
Oh my gosh.
But it sounds like we've already roped you into coming back.
I would love to come back. That sounds great. We'll look forward to it next time.
Do that.
Absolutely.
Well, thank you so much for speaking with us today, Wade. That was brilliant.
Yeah.
Thank you so much for having me. This was a lot of fun. It was a really big honor to be on this podcast. Absolutely.
Thank you.
Yeah, absolutely. Thanks so much.
Well, to all our listeners, hope you enjoyed that as much as we did, as you can tell by our voices. But we'll be here again with so many more episodes. So stay tuned and goodbye.
Bye.